Do you have one of these Medicare plans? Well, if so, pay close attention because this October, these plans are going to have some of the biggest changes coming your way. Stay tuned to find out what changes are happening, how it could impact your coverage in 2026, and the action you need to take to make sure you save money and have the most comprehensive coverage. Hi, I'm Erika Smiley, one of the educators here at MedicareSchool.com, and we want to be your trusted source for all things Medicare. And in this video today, we're going to talk about what these plans are, why they change, what changes are coming, and what you need to do to take action this fall. Now, if you're new to Medicare, and maybe this is your first or second year in Medicare, you may not know that Medicare Advantage plans are calendar year plans that change each year. Now, what do I mean change? Well, these insurance companies have the right to make changes to the plans or even get rid of these plans on an annual basis. Deft research said that 1.8 million people lost their Advantage plans in 2024 because the contracts weren't renewed. And we expect the same thing to happen again with 2025 as we're moving into 2026. Now, why do they change? Because Medicare has one-year contracts with private insurance companies that offer these Medicare Advantage plans. Now, they have the option to renew the plan, change it, or cancel it each year. So let's look at what changes could be coming if you have an Advantage plan for 2026. So what about these Advantage plans can be changed? Well, first of all, the entire plan could be dropped. So we just said that like 1.8 million people, 1.8 million beneficiaries found out that their plans were canceled and they have to get a new plan. So the plan entirely could be canceled and they could say, hey, we're going to put you on a different plan or you need to get on a different plan. Next, the networks could change. So if you have an Advantage plan now, hopefully you know you're either in an HMO, an HMO POS, or a PPO plan. And there's networks, right? So you have to make sure your doctor are in networks. So they can make changes to these networks. A doctor may decide to no longer take the Advantage plans. The Advantage plans may drop a whole hospital system or doctors from the plan. So you need to check each year, is my doctor still going to be in network on this plan for next year? Okay. Now the financials of the plans could change. So the premium, right now most Advantage plans are $0. That could go up. Maybe that Advantage plan is going to be $15 or $30 in the future. So the premium could change. The deductibles could change. The co-pays could change. The co-insurance could change. Maybe your plan last year was 80-20, and now the co-insurance is going to be 90-10, okay? And then the max out of pocket could change. So it could go from maybe a $4,000 max out of pocket to a $6,000 max out of pocket. So any of these financials could be tweaked or changed on that Advantage plan. And lastly, the perks could be changed. So a lot of people are saying they're getting a little bit more stingy with some of the perks. When I talk about perks, we're talking about dental, vision, and hearing benefits that come with the plans. Depending on what Advantage plan you're on, they're different amounts. Sometimes it only offers $1,000 in dental coverage. Sometimes it's up to $3,000 in dental coverage. So that could change from calendar year to calendar year. Same with the vision and the hearing. Usually the wellness benefit, that's probably going to stay the same if it's Silver Sneakers or if it's Renew Active and what gyms are included in that. It's probably going to be more the dental, vision, and hearing that you might see changes to when it comes to perks on your plan. What else do you need to look at when changes are coming this fall on these plans? Well, first of all, your Part D prescription coverage is usually wrapped in that Advantage plan. So here's some things you want to look at when it comes to what's being covered on your medications, okay? So first of all, are your medications you're taking still on formulary? So when we work with people, we always ask them what medications they're on, what the doses are, so we can check and make sure we get them the right Advantage plan that's going to cover their medications. So if you're on a pricier drug and it's on your plan's formulary right now, but they're going to drop that medication from the formulary for next year, you would want to make sure you get on a different plan. Now, not only is that medication still on the formulary, but what tier is it in? So again, we have tiers 1 through 5. Tier 1 is going to be those preferred generics, then we have generics, then it goes up all the way to tier 5 to specialty medications. So the price of the medication depends on what tier that medicine is. So maybe you had a medication that was like, tier 3, but now it's going up to a tier 4 or a tier 5, and that's going to increase your cost. These are all things to look at. The other thing that could change are your copays. So what are your copays? What were your copays this year in 2025 for your medications, and what will they be if you stay with the same plan in 2026? Also, we know some changes that are going to be coming to all Part D drug plans, and that's for 2026, that catastrophic cap. The catastrophic cap is actually a good thing. Sounds bad, the word catastrophic, but right now in 2025, it's $2,000. So this means that once you hit $2,000 in out-of-pocket costs for your medications, everything else is going to be completely covered for the rest of the year. Well, we know that catastrophic cap is going up to $2,100 for 2026. So not a huge increase, just $100 for that catastrophic cap. So that means the most you'll spend on medications is $2,100, and then the rest will be covered the rest of the year. Now the deductible is going up. Usually on these plans, if a medication is a generic, so if it's on tier 1 or tier 2, usually that doesn't count towards the deductible. But if you're on those more expensive medications, tier 3, 4, or 5, a lot of times the deductible applies. So this year in 2025, the deductible, the max deductible that was allowed on all these plans was $590. That's going up in 2026 to $615. That's going to be the new deductible. That's the number that we're hearing. But again, that's going to change for everybody, and that's on all standalone Part D plans and any drug coverage that's included in these Advantage plans as well. Hey, if you found this video helpful, do us a favor. Go give us a like. We always appreciate it. And subscribe so you don't miss out on any of those future videos. And leave us a comment. We'd love to hear what you have to say. We love to answer any questions you have. That's what it's here for. So drop us a comment below. So there's actually some good news and some good changes that are coming in 2026 around prior authorizations when it has to do with these Advantage plans. So we talk a lot about comparing supplemental to Advantage plans, and one of the downsides of Advantage plans can be dealing with prior authorizations. So again, what that means is if you need to get a shoulder surgery or a hip surgery and you have an Advantage plan, a lot of times that prior authorization has to go in and it has to be approved by the insurance company for you to get that surgery or that procedure. So they're tightening up the way prior authorizations work in the Medicare Advantage system. So first of all, they want to help reduce delays. So for non-urgent requests, they're going to take that from a 14-day period down to a 7-day period to get those approved and get a decision made. They're also going to improve transparency with these. So just, kind of being more open about how they make decisions and things like that. And this includes public reporting. So just putting more transparency out there with the statistics of approval rates, how they make decisions and things like that. They're also going to be held accountable for justifying denials. They can't just say, sorry, no, we're not approving it without any kind of justification. And also another good change is going to be care continuity. So meaning if, let's say, a change is coming to your Advantage plan, right? Maybe you have a surgery scheduled for January 10th of 2026, and in December you find out, my plan's changing, I want to make a change, but I already had a prior authorization and now I have to switch Advantage plans. Well, they're going to make it if your previous plan approved that prior authorization, the new insurance carrier, if you switch plans, has to accept that if it's been within 90 days. So if you have a prior authorization approval within 90 days and you have to switch plans for some reason, to keep that continuity of care, the new plan has to also allow you to use that prior authorization. So now we talked about what some of these changes could be. How are you supposed to know if there's changes being made to your plan or not? Well, you're going to get a letter in the mail from the carrier, and this is called the ANOC. We call it the ANOC letter. It's the Annual Notice of Change. So they have to send you this letter. They start mailing them out mid-September, but you should have your letter by October 15th, okay? So if you get a letter from your Advantage company or anything from an insurance company, just keep an eye on your mail from mid-September through October 15th for that Annual Notice of Change, because this letter is going to let you know the changes that are going to be happening to your plan, or if you're going to lose your plan altogether and need to find another plan, okay? So keep your eye out for that, and just know that there's a period called the AEP, Annual Enrollment Period, of when you're allowed to make changes to your plan. So this starts October 15th and it goes through December 7th. That's the time window when you can say, hey, okay, I've got changes to my plans. I'm not happy, I don't like it, they're doing this to my perks, or they're changing my max out of pocket, or my doctor's not in network anymore, I want to change. So this is when you can call us and we can compare those plans for you and we can get you set up in a new plan. Now we can do that from October 15th through December 7th, and all you have to do is call and schedule an appointment with us. You can also go to medicareschool.com, and there's a thing to click there to schedule an appointment. But any changes we make for you, we'll pick out a plan from October 15th through December 7th, and that plan will take effect on January 1st. So by then we'll have the new plans, we'll be able to see the 2026 Advantage plans, and we'll be able to pick you out your new plan, which will take effect on January 1st. Now, don't worry if you don't have your letter by October 15th. You can always reach out to your insurance company. Maybe it got lost in the mail. They'll make sure they get you your letter. But keep an eye out for it. And if you want to learn a lot more about this ANOC letter that's coming, make sure you check out this awesome video from our founder, Marvin Music. He goes into details and tell you all about the ANOC letter and what to expect.